It's Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. Tuesday's Supreme Court election set records for spending and for turnout, and it sets the course for Wisconsin's high court, possibly for years to come.
But does the outcome have a deeper meaning at the state and national level? Political observers are digging into the results for lessons about American politics and trends.
Craig Gilbert is with us to sort it out and find out what happened in key parts of the state. He's a columnist with the Milwaukee Journal-Sentinel and fellow at the Lubar Center for Public Policy Research and Civic Education at Marquette University Law School. Craig, welcome back to Wisconsin Today.
It's great to be with you.
Craig, it doesn't seem like that long ago that April Supreme Court elections were pretty sleepy, right? 2017, the winner beat unopposed. There was only one candidate in that race. Things have changed. Talk about the turnout and the interest in this race.
Yeah, the turnout was, I think, surprised even people who were closely involved in the campaign, who were expecting an increase in turnout. I was expecting an increase in turnout. I mean, you can't spend all that money in a world that is this polarized with all the things that are going on right now, and not expect people to want to make their voices heard. And so it's part of a long-term trend with these races. Like you said, they used to be sleepy, and as they became more partisan and more divisive, and as the perceived stakes in control of the Wisconsin Supreme Court grew, that resulted in more people voting. But you know, we took whole nother step in this election, I think, and that had a lot to do with not only spending that much more money, but it had a lot to do with Elon Musk and Donald Trump. Right.
And a lot of national observers, Craig, are looking at this as a referendum. What does a swing state like Wisconsin think about Donald Trump and Elon Musk, who were especially Musk, heavily involved in this campaign? Yet, this is a state Supreme Court race. There are state issues like abortion, redistricting, labor rights, and more. Can we sort out? Is it possible to sort out how much state factors weighed in here versus this nationalized version of an election?
Well, we can't sort it out with any precision. And I think the word referendum is a really tricky word because it just sort of suggests that people are casting an up or down vote purely on the president or purely on Elon Musk, which obviously isn't the case.
Right.
But I also think it's a mistake to be sort of too dismissive of this race. I mean, some of the analysis and some of the spin coming from the losing side has been, you know, these low turnout elections, special elections, low turnout elections, off-year elections are entirely about which side is angrier, and the Democrats are angrier right now. And so that's why the liberal candidate won. And I think that is too dismissive because this was not a special election. It was not a low turnout election. I mean, it was the number of people that voted in Wisconsin was the equivalent of 70% of the presidential vote and almost 90% of the last midterm. Not only that, it was bigger than the midterm turnout in like 3/4 of the 50 states in the last midterms in the US in 2022. That's a huge electorate. So it's not in an electorate that big, it is not absolutely entirely about base versus base. I mean, there are people voting in this election who are not, you know, hardcore partisan Democrats and hardcore partisan Republicans. And so in that sense, I do think there is a broader meaning.
The Republican theory of the game was there are those Republican voters who turn out in presidential races, not in April elections. The Elon Musk strategy was we're going to try to connect Brad Schimmel to Donald Trump. And we saw lots of flyers with pictures of both of them in it. We're going to put money into motivating those voters. The question is, did they actually end up motivating more Democrats, more people on the other side than their own voters? What did you see there?
Yeah, I think that's quite possible. I mean, again, we don't know. And, you know, you could argue, as some Republicans have, that all the money Elon Musk spent did serve to kind of level the financial playing field in this race and did turn out some Republicans. But, you know, again, this was such a big outpouring of voters. And, you know, clearly what's going on, you know, you mentioned their desire to get something closer to a presidential turnout. And, you know, in two of the last three presidential elections, Donald Trump has won at that presidential turnout level, but he's only won by a fraction. And so, you know, imagine replaying the presidential election today with everything that's going on. You might not have the same result. So it wasn't as simple as the more people that vote, the better it is for the conservative candidate, clearly, because the climate is different. And, obviously Democrats are helped by the fact that they're more motivated than Republicans, but that in itself is a consequence of what's going on in Washington and around the world right now. And that in itself is a problem for Republicans. And it could be a problem in the 2026 midterms.
Talking to longtime political observer Craig Gilbert about lessons we can and can't learn from Tuesday's election. Craig, let's get geographical now. I want to start in southwestern Wisconsin. We've talked before about Crawford County. I think you wrote years ago it was the biggest flip from Obama to Trump. It is a flippy county. It went toward Donald Trump in the presidential election, now to Susan Crawford, no relation, in this election. What's going on over there?
Yeah, if you just look at sort of the drop off in the margin for Donald Trump in 2024 for president again, and comparing that to the margin for Brad Schimmel versus Susan Crawford in this election, the biggest drop-offs between the presidential result and the court result were in southwestern Wisconsin. I mean, Lafayette, Richland, La Crosse, Crawford, Iowa. So that's a quirky part of the state where voters have been very swingy, and they have swung in a Republican direction for Donald Trump in recent cycles. But the same thing hasn't happened to the same degree in other elections in the midterms, and it certainly hasn't happened in these court elections. And so if you look at kind of like the state by region, and you look at the La Crosse TV market, which is like 12 counties, but it's that southwestern Wisconsin region. Donald Trump, won that region in 2024 by 8 points, and he won it by 5 points in 2020. But in all these races, all these court races we're talking about, the Liberal candidate is winning the La Crosse region by anywhere from 5 to 10 or 12 points. And in this case, Susan Crawford won it by 7 points. So again, you see, especially in western Wisconsin, but all across the state, you see this gap between the presidential performance and the court performance.
On the opposite end of the state, northeastern Wisconsin, we've got the WOW counties around Milwaukee. Well, there's the BOW counties, Brown, Outagamie, Winnebago, Fox Cities, Green Bay. Again, trending away from the Trump outcome toward the Liberal, the Crawford outcome in this race. More people there to watch for. A swing there can really swing a tight election. This wasn't a tight election. What are you looking to learn there?
Yeah, again, these counties are really interesting because they're pretty purple and they're real battlegrounds. And if you look at Brown County, which is where kind of Green Bay is, again, the Liberal court candidate has been winning by very modest amounts, but consistently winning in these races by 3, 4, 5 points, and again by 3 points in this election, even though at the presidential level, Brown County has been captured, Outagamie has been captured by Donald Trump by 8, 9, or 10 points. So again, it is a different electorate, and it's valid to point out that difference. But these are counties that are also, again, I don't think it's 100% just base versus base and motivation. It's also, these are counties where you find persuadable voters. I mean, the Green Bay market has always been super attractive to campaigns because it's not super expensive, but it's got a higher proportion of swing voters than, for example, traditionally the Milwaukee and Madison markets have had. So it's been a super battleground at the presidential level and in these other states. So there's a reason why people watch the Fox Valley so closely.
Another closely watched phenomenon in every Wisconsin election is how much turnout and run-up can the Democrats get in Dane County and Milwaukee County? How much can Republicans do in the WOW counties, those suburban counties around Milwaukee? What did you see?
Again, in the WOW counties, there's been a long-term decline in Republican margins. In this case, it was, not a whole lot different from the 2023 court race. But the long-term trend has been much smaller margins. You talked about the old days in court races, and in Waukesha County, the conservative candidate was winning by 35, 40, 45 points. And, in 2023, that was down to 16 points, and it was down to 15 points in this election. So that's, that part of the state has changed. Milwaukee County, good turnout, probably better than some people associated with the Crawford campaign expected. And again, a lot of that is what's happened in the inner Milwaukee suburbs, which have just gotten kind of a lot bluer. And when we talk about, this turnout problem for Republicans structurally in these lower turnout elections, the parties have realigned, and there are more college-educated voters in the Democratic Party and fewer working-class voters. And education tends to be a predictor of turnout in lower turnout elections. So Republicans are facing that challenge, losing 4 out of the last 5 court races, all in each case by double digits. And Dane County is a perfect example, because in Dane County, you not only have the problem of Dane County turning out disproportionately in these spring elections. I mean, it was almost like 80% of the presidential turnout. But you have it was a great illustration of how motivated the Democratic base is. I mean, the Susan Crawford won Dane County by more than 180,000 votes, which is basically a presidential level margin for Democrats. And to have that in a spring election is pretty astounding. And it's just a huge hurdle for Republicans to overcome by trying to offset that vote in a lot of smaller counties around the state.
Craig, we'll leave it there. Thanks, as always, for joining us today.
Absolutely.
That's Craig Gilbert, a fellow at the Lubar Center for Public Policy Research and Civic Education at Marquette University Law School. He's also a columnist at the Milwaukee Journal-Sentinel, where he was a long-time political reporter. You can read his latest column at the Milwaukee Journal's website. Plus, visit WPR.org for more election analysis from our WPR News team. If you have thoughts, commentary, or prognostications for next year's election based on the lessons learned this week, tell us about it. Email wisconsintoday@wpr.org. That's wisconsintoday@wpr.org.
Coming up on Wisconsin Today, money from opioid settlements is flowing into communities around the state. An ER doctor in La Crosse talks about efforts to stop accidental overdoses and get people the help they need.
The access to Narcan has really made a big difference. I think that is probably the most key component of this.
That's next from WPR News.
It's Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. Wisconsin is set to receive $21.8 million from one of the nation's largest grocery chains as part of ongoing settlements over the opioid crisis.
Kroger operates over 100 stores across Wisconsin. It's paying for its role in fueling a deadly opioid epidemic when communities were flooded with addictive painkillers.
The settlement is part of a much larger sum, $780 million, that Wisconsin will receive through 2038 to address the opioid crisis.
As Wisconsin begins to receive these funds, the state is seeing a decrease in opioid overdose deaths since the peak in 2022, but still more than 1,000 people are dying each year from opioid use.
To learn more about how communities are using settlement funds and what the opioid crisis looks like now, we turn to Dr. Chris Eberlein, an emergency room doctor at Gunderson by Amplify in La Crosse and co-founder of Alliance to Heal. It's a group in La Crosse that helps individuals suffering from opioid addiction. Dr. Eberlein, welcome to Wisconsin Today.
Thank you very much for having me on today.
What stands out to you about the Kroger settlement and this addiction epidemic? What do you see?
Settlement funds obviously are welcome. Funding is really important as we go forward, trying to continue to improve where we are with the opioid epidemic. We have seen improvement in the last year in particular, the first time since I think about 2012, since we've seen a reduction in opioid overdose deaths. So that was very welcome. But we still have a long ways to go. There are still people dying throughout our state and country every day from this epidemic. And Truly, my condolences to those that have lost people in this, family members, friends. It's impacted me as well. The money won't bring them back,
Mm.
but it will hopefully help us so other people don't suffer.
It's impacted you as well. Is there a patient story or an emergency room memory that you recall when you knew that this opioid crisis was out of control?
It was really volume. Started to see this really increase in the early 2000s. And when I first started training, opiate overdoses were relatively rare, but then we had this wave of overdoses. And initially, primarily, it was from prescription medications, which to me was, really upsetting as a provider that, gee, are we doing harm here? And when we started to see that, and then we tackled that head on with education and the PDMP and more data, and then we saw the epidemic change gears and move into heroin and fentanyl, and it just continued to be fueled by that.
PDMP is the prescription drug monitoring program in the state. Is that right?
Correct.
Yeah.
Yes, that is correct. And I think that was a really, really important piece in getting in front of the prescription part of this. But then we had that shift to fentanyl and heroin first and then fentanyl, that was really deadly. And we're still seeing that, but increasing doses of Narcan. And when 20 years ago, the Narcan dose is like 0.1 milligrams. And now we're up to 4 to 8 initial dosing, which so a multitude increase in what it takes to reverse these overdoses.
Recently, Governor Evers extended the state's electronic prescription drug monitoring program. Can you talk further about what role have pharmacies played in this crisis and this type of monitoring that is going on?
Yeah, for sure. This was early on when the epidemic was really fueled a lot by prescription drugs. There was no centralized place for a provider to know if a patient was getting prescriptions from more than one prescriber. So this had a centralized database for that, and it was became very easy to check as well. It got incorporated into our medical records, and so you were quickly able to look and see not only where all they were getting their prescriptions, but it would actually kind of give you a graphical analysis of how much they were getting and if they're in a danger zone as far as potential for overdoses. That's even gone farther now to the point where the medical record now will actually trigger and recommend Narcan prescribing if someone is taking, for example, a higher dose than normal of opiates or opiates with another sedative.
Hmm. And, through this program, it sounds like there is a layering effect with healthcare providers as part of it, health officials, law enforcement, and other types of agencies. Do you find that there is more cross coordination today than there has been in past decades?
I think a lot of these groups that were developed to help combat this opiate epidemic quickly realized that without coordination amongst the other groups, you were truly isolated, and you really couldn't get nearly as far. And so even today we're doing monitoring of overdoses, and we take a look at locally at our overdose calls by EMS. And every week we get together and we do a brief summary. But with that, we also include law enforcement, and we also include the county and the hospital. So that way you can get more of a clear picture, because one group may be seeing something that the other group isn't, and you're missing a big part of the picture. And clearly this is such a complex issue that you really need everyone involved if you're going to make a difference.
I would imagine as well, with a clear picture for someone, you're able to then connect them with the resources that they would absolutely require to put them on a path to recovery. Does it also give you a clearer direction for a patient?
I think that has been one of the struggles, is connecting the patient with the right treatment, and there's a lot of trial and error there.
Mm.
But without communication between providers and other support services, you're really not going to find it. So it is really helpful to have those groups communicating and working towards what's best for the patient.
Opioid overdose deaths here in Wisconsin, they peaked in 2022 with 1,459 deaths. That's Wisconsin Health Department data there. And year ending June 2024, I know you watched these numbers as well, 1,075 deaths. Is this a significant decrease?
Any decrease is significant. But this one, we have been seeing across the country, 20 to 30% reduction year over year in this last year. La Crosse County, we were very fortunate. We had a 70% reduction in our overdose deaths here. Still waiting to see if that holds for the next year, both across the country and locally, because we're really not completely sure what to contribute that to. There are a lot of theories. One of the most prevalent is all the work that we've done is finally caught up. We knew it would take a long time to get ahead of this and start to make things change. Time will tell if this continues to be a positive trend.
And then the National Institute on Drug Abuse has found that fentanyl-related deaths specifically have dropped 30% in just 1 year. And this is after years and years of devastating increases by fentanyl and other toxic drugs. Do you know what's behind that drop?
Once again, I think it's a lot of the same. I think we've done a really good job with harm reduction. The access to Narcan has really made a big difference. So I think that is probably the most key component of this. Education on not using alone, because you can't give yourself Narcan when you're obtunded. And then ongoing support for those that need it. You really have to have it where if someone wants to get help, you can't have a bunch of barriers to someone for getting that help. And so continually breaking down the barriers so it is very easy for someone to find the resources they need and get the help they need. We're still not there yet. There are still barriers that we have to work on. And I think some of this opiate settlement fund should and does appear to be going to some of that. We need that to continue.
We are talking about the opioid crisis and how communities are beginning to use settlement funds. Emergency room physician Chris Eberlein is here from Gunderson by Amplify in La Crosse. Dr. Eberlein, Wisconsin receiving $75 million in opioid settlement funds since 2023. Can you trace this? How is this money being used by communities?
So there's several things, and unfortunately, I'll probably miss a couple of them. But one of the things that we talked about a little bit is making sure that we have Narcan availability. That's a drug; it's not free. So making sure that we are able to give Narcan and get it to people that we need it, either Narcan leave behind programs, direct to people that need it. So that's been a very important component of this. The fentanyl and xylazine testing strips too, making sure that people have the ability to test what they're using to see how risky it is. And then getting into things like medication-assisted treatment funding, peer support services. These things really do make an impact. We have to keep doing education as well. So all of these sorts of programs are what it's aimed at doing, including also law enforcement, making sure that that they have the resources they need to help combat the illicit drugs. But the one thing that I think we have to really make sure if we really want to get in front of this is ongoing support for mental health. And one of the concerns for those of us working on this field is that if these dollars are too restricted, you may not be able to use them for getting way downstream. And what I mean by that is we really have to work at far downstream prevention in our behavioral health services, because we don't want people to get into that despair where they turn to drugs. We want to stop that prior to it happening. And one of those things is going to be increased mental health resources, not always specific to addiction at the time.
If that means like behavioral health or one-on-one counseling, we have a shortage of mental health providers in Wisconsin.
Absolutely, we do. In fact, many areas of the country do, which is also why it's going to be very important to continue to look at ways that we can utilize the providers we have more efficiently and support them. I think some of the telemedicine virtual visits for this are extremely helpful, especially for our rural communities. And so it's really important to make sure funding for that sort of system continues. That was approved during COVID because, obviously people are isolated and isolating to avoid getting sick. There was an expansion in payments for virtual services. Um, Fortunately, it looks like that has been extended, but that's always a threat. If that goes away, we'll lose a lot of these sorts of services. And I think people are becoming more and more dependent on that. It's been shown to be helpful. There are times where someone needs to see someone face to face, but if you can do 75% of these virtually, it makes a big difference. Really helps take those providers in areas that might not be as busy, or they may have a few more providers, to be able to go across state lines even and do a virtual visit is really important.
As we talk, thousands of health workers in the CDC and the Food and Drug Administration have lost their jobs as part of mass federal layoffs. We're seeing 2 offices at the National Institute on Drug Abuse shut down. The Substance Abuse and Mental Health Services Administration closing offices. What impact could this have on the opioid crisis here in our state?
This is something that is always, anytime you start to see any cuts like this in an area that we have, we still have problems. I mean, it puts a lot of these areas at risk. And, and we need to make sure that we continue to fund those areas that are being successful. They're making a difference in people's lives. And there are certain areas that cutting them will cause deaths, and that is one of them.
Mm. $10 million was allocated in 2023 to build and renovate treatment facilities. And I'm wondering, what have you seen in the way of infrastructure and treatment facilities development?
We haven't seen a lot in our area on this side of the state. In fact, we're still kind of reeling from the recent closure up in Eau Claire. The L.A. Phillips had an inpatient treatment center that a lot of our patients were referred to. So that is something that is part of this funding that I think is really key, is making sure that we continue to expand that. One of the things that we actually talked about today at an opiate discussion I had earlier was, when you're too dependent upon grant funding, it's hard to do long-term projections. What I mean by that is, if every 2 years you're coming back hoping that your grant is still there, it's hard to plan out 5 and 10 years. And when you're building a treatment center, this is not a 2-year plan. So I think at some point we really have to look at sustainability, and where that comes from is changing our payment structure for behavioral health and mental health and a lot of primary prevention services. So that way the reimbursement is in line with the cost, because right now it is not. That is why so many hospitals have closed their mental health units and substance abuse services, because the inpatient funding is not where it needs to be. If there was money in it, like most things in a capitalist society, you have enough of it. We do not have enough of this, and I think that's directly related in a lot of ways to funding.
When you talk about the funding of grants, it also makes me think that the hundreds of millions of dollars of settlement funds being directed toward Wisconsin, those too one day will run out. Do you think about that?
100%. And that's why I think we really need to look at how we can change this into a sustainable model. And grant funding in general for this stuff, like I said, it's very helpful. And a lot of these programs wouldn't exist without it. However, if you really want to look at sustainability for these programs, at some point we have to look at how we we really pay for things, and look at an underlying change to how we reimburse for these services.
I imagine an emergency room is such a difficult place to be day in and day out. And I'm wondering, in terms of this particular crisis, where do you see glimmers of hope?
Well, a few areas. One, we do see fewer people dying, which is incredible. And that was one of our goals. Our goal is 0 deaths.
Mm-hmm.
We are seeing fewer people coming in after an acute overdose that was not able to be treated in the field because of this expansion of Narcan and more people using that. The downside to having more Narcan in the community, there's only one downside that I can see, and that is some of these people then don't come in. When they would get Narcan from EMS only, often they were transferred into the hospital, vast majority. But now we are finding as Narcan has become more prevalent throughout our communities, they are being treated by their friends and family, and oftentimes once they wake up, they refuse transfer or never even call. So that then we are missing an opportunity to intervene and give them some of these support services.
Dr. Eberlein, thank you so much for your time. Thank you for joining us.
Pleasure, and it's always an important topic and good to keep people informed.
Dr. Chris Eberlein there, an emergency room doctor at Gunderson by Amplify in La Crosse. He talked about how Wisconsin is using settlement funds from lawsuits over the opioid crisis. For help, call the free and confidential treatment referral hotline. The number is 1-800-662-HELP. That's 1-800-662-HELP, or visit findtreatment.gov. And for disclosure, Amplify Health is a business sponsor of Wisconsin Public Radio.
Coming up, from immigrant neighborhood to hippie haven, a new documentary tells the story of Milwaukee's Brady Street.
You step out your door and you can talk to people. Everybody knows each other. You might stop over at the bar, or you maybe stop over at the coffee shop, or the restaurant over there, or the bakery, or the churches. But everybody knows each other in this neighborhood, and it's very welcoming.
A slice of Wisconsin history coming up on Wisconsin Today.
You're listening to Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. Now it's time for Wisconsin Life. Here's producer Tyler Ditter with a story about a spooky book that takes place in Milwaukee.
Imagine that you're a 12-year-old Milwaukee Sentinel paperboy wandering through an unknown Milwaukee neighborhood on a cold Wisconsin winter evening in 1987. Dan Coyce has been there, and it made such an impression on him that he's written a frightening and funny novel all about it. The book is called Hampton Heights, One Harrowing Night in the Most Haunted Neighborhood in Milwaukee, Wisconsin. Coyce sat down with Doug Gordon of WPR's Beta to talk about writing the book and living through the events that inspired the book.
Hampton Heights is the story of 6 middle school paperboys who live around the east side and in Milwaukee. They're all taken out in a van by their stupid manager, Kevin, to sell Milwaukee Sentinel subscriptions in a neighborhood chosen randomly, in this case, Hampton Heights. They're set loose on the streets in pairs. They're told whoever sells the most gets $20, and when it's all over, they all get to go to Burger King. While they're there, they also discover that they have been inadvertently dropped into Milwaukee's most haunted neighborhood, and each pair of boys, as well as their stupid manager, Kevin, will have to encounter and overcome certain supernatural creatures. What I imagined was not only the monsters, but also the kind of delicate but real peace and comedy between two populations that are in those sort of similar moments of transition, moments that sometimes can create real strife, but in other circumstances create a kind of like banding together and a comprehension that for all these populations' differences and for all the real tensions between them, they're in the same boat. And the real enemy is the corporations, the factories that are closing, the people who are trying to keep those middle class or working class people down.
These kids are dealing with witches, trolls, werewolves, and hodags. How do the kids react to these creatures?
They react often in terror, but they're also kids who have watched a lot of horror movies, read a lot of Stephen King, and view these monsters they encounter as bigger and weirder challenges than the challenges they usually face, but not truly unique. They're still in scrapes that they feel they can think, talk, or act their way out of. Part of the fun of the book, I think, is watching each of these pairs of kids find the reserves inside themselves to help them overcome or survive these scrapes they get into. And so I wanted to show these kids being surprised and frightened, but also feeling like, oh, I wonder how I can get out of this one. In the same way they would think, oh, I wonder how I can get out of the big kids from the high school caught me throwing water balloons at their car or something like that.
You have said that as you were writing Hampton Heights, you started thinking of it as gentle horror. How so?
As I said, I'm cagey about spoiling what happens in individual stories, but I love making sure everyone knows before they start this book that at the end of the book, the kids are fine and they go to Burger King. That's important to me. You know, I liked the idea of a story in which the kids are in peril in some way and they face challenges, but what you're going through as a reader is not the kind of prototypical horror experience of waiting for the author to punish them in some unique, shocking, surprising, or delightful way. I wanted the sort of unbelievable creativity in this book to come out of the ways the kids find to escape these experiences. And so it was important to me to always sort of give off the vibe in the book that whatever happens, these kids are going to make it through and they're not going to suffer too badly. Now, adults, who knows? Adults might be fair game. Sorry to their manager, Kevin. You never know what's going to happen to that guy. But the kids are going to get their burgers.
That was author Dan Kois, who grew up in Milwaukee. To hear the full conversation, check out WPR's Beta. Wisconsin Life is a co-production of Wisconsin Public Radio and PBS Wisconsin in partnership with Wisconsin Humanities. Additional support comes from Lowell and Mary Peterson of Appleton. I'm Tyler Ditter.
This is Wisconsin Today.
A new documentary screening at the Milwaukee Film Festival tells the history of the city's historic Brady Street, from its earliest roots to the present day and through eras of immigration.
And very quickly, by the early 50s, this neighborhood became an Italian neighborhood, flipped it, and it almost, for the most part, became known as the Little Italy of Milwaukee.
The film Brady Street, Portrait of a Neighborhood, was made over the course of 2 years by 80 UW-Milwaukee film students and directed by Sean Kafer, who joins us. He's program director for DOC UWM, UW-Milwaukee's documentary program. Sean, welcome to Wisconsin Today.
Hey, thank you for having me.
For people not familiar with Brady Street, people maybe listening from elsewhere in the state who haven't gone there to see a show or get pizza or whatever the case may be, introduce us to this part of Milwaukee, this slice of Milwaukee.
Yeah, well, Brady Street is one of these streets. It's probably the neighborhood is one of the most condensed neighborhoods in the state. And right now you might find some of the city's finer restaurants. It's famous for its bar life, but it's also this rich history of one side of the street being Polish immigrants and the other side being Italian immigrants. But it's also really well known for its counterculture. Yes. During the 60s and 70s, this was the Haight-Ashbury kind of part of the Midwest.
And as I was watching, kind of a theme emerged, and I hope you don't mind a little spoiler here. One of the people you talked to right toward the end spells it out for me. She says, it's people that make the street. And that really sums it up so much. How did you bring people to life? Obviously, some of them are still around. In the more recent parts of the story, you're going back a century and a half. Talk about that people focus.
I know. And the funny thing is, that's Julie Kohler who said that. And she was actually our very last interview, but she did absolutely bring it all home at the very end. And how that happened is we started off with our first interview being Frank Aliotto to kind of lay a backbone on the project. And then I asked him, who should we talk to? And other people told us who we should talk to, and it kept growing just into bigger, wider, different branches going in different directions. And that's what really helped us find all these great interviews.
And that theme, too, a lot of these are bustling communities, right? Whether you're talking about the Polish or German immigrants, the Italian immigrants, we'll talk about them a little more. The modern day, when there's a downside in the movie or in the documentary, it's in the 70s, 80s. A lot of the businesses have closed. People aren't out on the streets, for fun, good reasons. The livelihood of the street, the thing that makes it culturally unique, rises and falls depending on how much people are out there and participating and doing stuff. Can you talk a little about how that emerged as a theme?
So, what happened was by the late 70s, they stopped having the Brady Street Festival, one of the things that the street is famous for. And when that stopped, a lot of the life kind of went away. And people would not go to the businesses. There wasn't much of a reason to go to Brady Street. It got forgotten. Some of the businesses closed up. And that kind of left a place for maybe an invitation for crime and a reputation that wasn't so rich anymore until the residents kind of like pull back again and say, hey, let's not let the street go in that direction any further. Let's revitalize it.
We're talking to Sean Kafer with UW-Milwaukee's documentary department, director of the new documentary, along with a bunch of students in that program. It's called Brady Street, Portrait of a Neighborhood. Sean, let's visit in at different points of the history you share here. Starting with the person who begins and ends the documentary, a Mark Denning, cultural speaker, educator with UW-Milwaukee, enrolled the Oneida Tribe of Wisconsin. Could you tell a little bit about how he established that story of what became Brady Street and what was this natural area along the river there?
Well, yeah, Mr. Denning he's around in the community a lot. I actually have particular interest in sturgeon, and that's something that's very passionate about him. I had seen him on a number of different occasions. During COVID, he had these healing ceremonies, and I kept seeing him, and I thought we need some kind of history to this area before European settlement. So I kind of took a risk, and I reached out to him to see if he would like to talk about the Milwaukee area and what it meant to indigenous tribes and the river system. And he was very wonderful at presenting that for us. And just gave us a really rich history. He went on, and I never like having to cut things out, but some of the things he says are just phenomenal. And we thought, listening to the students, we talked about it. I was like, I think we should start with him and end with him because he had such a beautiful look at the progress of the rivers and the land and how we're moving ahead and the sturgeon and all these fish are coming back. I think at one point he said that these rivers, when he had first moved to the city, only had, I think, 2 or 3 species of fish, and now how it's flourished, the reintroduction. So it's this positive ending to the film that I really just loved, and the students really appreciated from him.
And then you focus in on various immigrant communities at different points in Milwaukee history. One of them, Polish immigrants, early immigrants in the Brady Street area, building a church in 1871 named the St. Hedwig Church, became the center of their community. Can you talk a little bit about the Polish era, the early Polish era in the Brady Street area?
Yeah, well, at that time period, the Polish immigrants in the city, that was the cheap labor for a lot of the factories. So when the tanneries came in, it was a lot of the Polish immigrants that moved into this area, which is really a wetland, just a swampland. They bring these different structures from different parts of the city and rebuild them. They put them on stilts. You'll learn a little bit about what's the famous Polish flat. But I think my favorite story of it all is when they build this church, St. Hedwig's, for the Polish community. There was a division for those that wanted their children to learn English and assimilate into this American culture, and the other part that wanted them to keep their Polish roots and speak Polish in the church and keep their kids having that language and that background. And there's a divide, and it turns into a bloody divide, and we have a story about it told by Frank Alioto, and it's quite fascinating. I know it gives me the chills every time I hear it.
Another group you focus in on is Italian immigrants in Milwaukee, and you've got some people who were there in some of the big heydays there, 1940s and 50s. What are some of the stories you'd heard from people who came maybe straight from Sicily, didn't know what they were getting into in Wisconsin?
Yeah, we were very lucky to find some individuals from that community that you could still hear that rich Sicilian accent or Italian accent that they have. There was one that was even tells her story about being a child bride. Well, the big thing is always the food, always these Italian markets over there. And that's one of the things that still remains in the neighborhood. You still have your Zaffiro's Pizza, which is one of my favorites. And then your Shortino's Bakery, which I absolutely love going to. And of course, Glorioso's Italian Market, which people from all over the state come to that. So it's still rich there. It's still vibrant. And of course, they had their own church too, and that's St. Rita's over on the southern part of the neighborhood.
Sean, something that really struck me watching it is that so many of the people you talk to, current and former business owners, residents, the hippies who had been through, everybody seemed conscious that this was a special place, a special neighborhood that had touched their lives. What did this Brady Street neighborhood mean to the people you were talking to?
Well, I think it's because it's so condensed and there's so much variety of things to do in this neighborhood that people just know each other. And there's that warmth and community that you just really feel. I know when I first moved to Milwaukee, one of the places I would go was Rochambeau, the coffee house there. And you knew the baristas over there, you knew the different people there, the people playing their chess, the people just coming there early in the morning and hanging out till late at night. Or maybe for some people, it's the bars or the different restaurants. We have a James Beard Award restaurant over there. And but it's people know each other and people like saying hi to each other. They like being around other people. And sometimes we miss that when we isolate ourselves too far and maybe in rural communities or whatnot. And those things are wonderful, but it's also nice to be around people too. And this is one of those places that you can do that.
This has been a long project in the making for you and your students. What did your students take away from this? Or at least what do you hope they took away from this experience, this super in-depth look at this one neighborhood?
Oh my gosh! On top of all the experience they got to work out a real film production here. 80 students, but the thing is, I think they learned a lot about the sense of community themselves. We just had a celebration for it, and a number of the students came over, and they were being greeted by some of the store owners or residents of the neighborhood that they'd done interviews with, and they remember them. They remember their names, and just seeing the smiles on the students' faces and also the residents' faces. I think that they feel part of that neighborhood now too, because we had such a warm reception of us being there, And I think we have to give props to the students too, because they were very respectful about how they went around traversing this neighborhood and finding these stories. And I think the neighborhood is reciprocal and really gave them a lot of love.
Sean, thanks so much for sharing this project with us.
Hey, it's my pleasure. Thank you for having me.
Sean Kafer is the program director for UW-Milwaukee's documentary department and director of the new documentary, Brady Street, Portrait of a Neighborhood. The film will be shown several times during the upcoming Milwaukee Film Festival. For more information, you can visit mkefilm.org. For full disclosure, Milwaukee Film Festival is a business sponsor of Wisconsin Public Radio.
Hearing about the documentary Brady Street is a clue that it is film festival season in Wisconsin.
The Wisconsin Film Festival is underway in Madison, and Milwaukee's festival opens later this month with hundreds of screenings between the two events.
We want to know if you go to film festivals for the documentaries, for the international movies, or maybe to see locally made projects by up-and-coming filmmakers.
Give a shout out to your local film festival or tell us about a favorite indie theater that you like to go to.
Let's hear about movies and film festivals in your community. Email us at wisconsintoday@wpr.org, or you can call or text to get in touch. That number is 888-642-0232.
Wisconsin Today producers include Mackenzie Crummy, Colleen Leahy, and Trevor Hook. Our technical directors are Sarah Hopeful and Tyler Ditter.
Tim Peterson is managing producer, and Dean Knetter is our executive producer. Learn more about us at wpr.org/Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrad. You're listening to WPR News.